So here are some real-life clinical examples of how AI can assist us. So here is a case of a 27-year-old woman with myopia, and she had complaints of metamorphopsia and decreased visual acuity in her right eye in the last 4 months. Basically here you can see her OCT. And it was analyzed by AI, and look what was found. So such biomarkers as diffuse edema, epiretinal fibrosis, cysts, retinal wrinkling, and lamellar macular hole were detected as a biomarker. In the classification, AI detected that the diagnosis might be an epiretinal fibrosis and lamellar macular hole. After that, this patient was referred to an ophthalmologist, and after all the examinations and investigation, the final ophthalmic diagnosis was epiretinal membrane, lamellar macular hole, and she was recommended to get a consultation with a vitreoretinal surgeon. So you can see how precise the diagnosis of AI was in this case. Another case of a 58-year-old man with myopia, and he had myopia since childhood, family history of glaucoma, no symptoms, and he came just for a new pair of glasses, and he was investigated with he underwent OCT examinations, and here what you can see. So if we look to classification detected by AI, so it was basically no pathology detected in this case, but it was detected the high level of glaucoma risk. So here you can see that AI, by analyzing the ganglion cell complex, detected the high risk of glaucoma in this patient. Again, he had no complaints, like nothing special. So he underwent additional diagnostic methods, and the final ophthalmic diagnosis was primary open-angle glaucoma on his both eyes. And basically, he started an anti-glaucoma treatment. And basically, AI was the first tool that detected the risk of this pathology. Again, one more case of a 67-year-old woman with complaints of decreased visual acuity during the last 2 months, and she had history of type 2 diabetes during 18 years, and you can see that the retina is damaged from her OCT exam, and basically look at what biomarkers were detected: diffuse edema, floaters, intraretinal hyperreflective foci, hard exudates, intraretinal cystoid fluid, and you can see the classification of AI was diabetic macular edema and diabetic retinopathy. So she underwent different examinations, and final ophthalmic diagnosis was diabetic retinopathy and diabetic macular edema, and she was prescribed anti-VEGF therapy. So basically, these 3 cases that were taken from our real life practice showed us that AI helps us not to miss pathologies even in early or asymptomatic stages, shows us how different pathologies basically look like with this coloring, which is also a part of our education, postgraduate education, gives us an idea of diagnosis and gives us confidence of what we see. And basically it makes our work more efficient, I would say. Right, Simon? What would you say?
Marvelous. Thank you, Maria. That glaucoma one absolutely fascinates me, because we probably just wouldn't have picked that up by any other method. Then suddenly there is AI saying, whoa, high risk of glaucoma there, and what happened? We're into saving this person's sight at a very early stage, and that's AI working for us. So question 6 then.